COVID-19, or coronavirus, is here. So it's important to have the correct information at hand, like knowing the symptoms: a high temperature, a cough, shortness of breath, or breathing difficulties. If you have symptoms, self-isolate to protect others and phone your GP. Visit hse.ie for updated factual information and advice, or give us a call. Protection from coronavirus. It's in our hands.
We sincerely hope that you will never be faced with this scenario, but this skill is an easy and effective tool that may potentially save an infant's life. If your child is choking, he may appear distressed. He may have a silent cough or cry. His face will be pale and his lips may be blue. If this happens, supporting your baby's head and neck with his head lower than the level of his chest, in between his shoulder blades with the heel of your hand, you need to hit him hard 5 times. 1, 2, 3, 4, 5. Don't worry about hurting your baby. You need to relieve this obstruction. Generally, back blows are enough to relieve the obstruction, but if your baby is still not breathing, you need to do 5 chest thrusts. This is done by using your 2 fingers in between the nipples, the lower half of his breastbone, going on an inward and upward motion to your baby's head. 1, 2, 3, 4, 5. You're going to continue doing chest thrusts and back blows until the object comes out or your baby goes unresponsive. If your baby goes unresponsive, you need to follow the guidelines for infant CPR. If you see the object in your baby's mouth and it is easy to remove it. However, never put your finger blindly into your baby's mouth, as you could push the object further back or you could injure the inside of their mouth, causing more problems. If your child has had a choking episode, they need to be followed up by a doctor.
For parents, one of the most frightening things that can happen is that their baby stops breathing. Follow these simple steps to administer CPR. Begin by placing the baby on a firm, flat surface. Gently stimulate the baby by tapping the foot or squeezing the hand. Shout for help if there's no response, but remain with the baby. If someone responds to your call, ask them to phone for an ambulance.
Mary, can you phone 999, get an ambulance, please?
Gently tilt the head into the neutral position to open the airway. Have a quick look in the mouth to see if there is anything visible. If there is, lift it out. With the head in this position, check for breathing. Look for a rise and fall in the chest and tummy. Listen for breath sounds. Feel for air from the baby's mouth on your cheek, taking no longer than 10 seconds. If your baby's not breathing, give 5 rescue breaths by blowing gently into the lungs, covering the baby's nose and mouth, ensuring there is good seal and you can see the chest rising. Each breath you give should be approximately 1 second in duration. If there are no signs of life, example eyes opening or limb movement, the baby's heart may not be beating properly and you must begin compressions on the chest. Place the tips of 2 fingers on the lower half of the breastbone and push the chest down gently but firmly to a depth of 4 centimeters. Push fast for a count of 30. Then give 2 breaths, followed by 30 compressions. Continue this sequence for 1 full minute. After this, if you are still on your own, make a call to the ambulance stating your emergency. Return quickly to the baby and begin with compressions, alternating breaths as seen, until the baby responds, or you can hand over to the ambulance.
Gastroesophageal reflux is called reflux for short. It is extremely common in all healthy infants, where contents from the stomach backwash into the esophagus 30 or more times every day. Some of it will be vomited or spat out, but most slides back down into the stomach. The frequency of reflux declines as baby gets older and generally decreases towards the end of the first year of life and is unusual in children older than 18 months. In the majority of infants, a focused history and physical examination will confirm that the reflux is uncomplicated and little further evaluation or intervention is usually required. Simple measures will usually help control the symptoms, like positioning your baby upright after feeds for about 10 to 20 minutes as they get their wind up, elevating the head of the mattress in the bassinet or cot with a small rolled up towel underneath the mattress, or thickening the feeds with a thickener. Warning signals that may suggest symptoms of obstruction or disease in a refluxing infant include the following: the presence of green bile in the vomit, gastrointestinal bleeding, which is characterised by blood in the vomit or blood in the stools, consistently forceful vomiting after every feed, onset of vomiting after 6 months of life, abdominal tenderness, abdominal distension, recurrent pneumonias or chest infections, constipation, and diarrhoea. Infants who have reflux and are not gaining the appropriate amount of weight for their age need to be seen by their GP or referred to a paediatrician for review. Reflux and poor weight gain also may be caused by food protein-induced gastrointestinal disease, and this is often referred to as cow's milk protein intolerance, because cow's milk protein is the most common trigger. All formula milk or non-breast milk is made up of cow's milk and will contain the cow's milk protein, whey and casein. Breastfeeding children can also develop cow's milk protein intolerance. For mothers who are breastfeeding, if they have a high dairy intake in their daily diet, some of the cow's milk protein will pass directly into their milk and subsequently into their child when feeding them. Symptoms may include the following: taking longer to feed, pulling off the breast or pulling off the bottle after soon starting a feed, crying associated with feeds, difficulty to burp and wind after feeding, lifting their legs a lot and passing a lot of wind, or being unsettled while they sleep. For most formula-fed infants with reflux and poor weight gain, which is thought to be due to cow's milk protein intolerance, we suggest a 2-week trial of an extensively hydrolyzed formula. For breastfeeding babies, we would advise the mums to remove all sources of beef and dairy from their diet and to replace with an equivalent substitute, ensuring they are getting sufficient amounts of calcium and vitamin D in their daily intake. Products that contain cow's milk protein or dairy products include such items like milk, cheese, yogurts, chocolate, ice cream and cream. The response to this change is often more delayed than in formula-fed infants because it takes some time to eliminate the offending protein from breast milk, and small amounts of milk or beef protein may be found in foods. If there is not a clear response to the diet change during the trial, other diagnoses and treatments should be explored. If you are concerned, please see your GP or paediatrician.